From surviving to thriving, the transformative power of mental health advocacy. Have you ever wondered what happens when we stop treating mental health as a whispered secret and start seeing it as a source of profound strength? When we transform our deepest wounds into our greatest wisdom. I recently had the privilege of sitting down with Mocha Brown, a revolutionary force in mental health advocacy, whose work has fundamentally altered how we understand the intersection of mental wellness, racial identity, and personal empowerment. To call her merely an advocate would be like calling the ocean merely water. She's an architect of transformation, rebuilding the very foundation of how we approach mental health in Black communities. Her groundbreaking framework doesn't just challenge the status quo, it shatters it, replacing outdated narratives of shame with powerful stories of resilience. What struck me most about our conversation wasn't just her intellectual brilliance, though that's undeniable, but how she's pioneered an approach that turns traditional mental health narratives completely upside down. While the world asks, can you survive your mental health challenges? Mocha boldly asks, how will these very struggles become the foundation for your most purposeful, impactful life? Let that sink in for a moment. So what if the very things that once threatened to break us could become our greatest source of power? What if our darkest moments could illuminate paths not just to healing, but to transformation? This isn't some feel good fantasy. This is the reality Mocha is helping create through her groundbreaking work that's especially vital for Black communities navigating systems that weren't designed with our well being in mind. When we talked about strength, Mocha didn't describe it as the absence of struggle. Instead, she painted a picture of strength as something forged in adversity, a profound capacity that emerges when we face our mental health challenges head on. This isn't about putting on a brave face or pushing through. It's about embracing vulnerability as the birthplace of authentic power. The journey through mental illness, she told me, demands a profound kind of strength, one that not only helps individuals survive, but empowers them to live with intention and purpose. I found myself nodding so vigorously, I nearly gave myself whiplash. Because how many of us have been taught that strength means silence, that power means pretending, that success means suffering without complaint? Too many of us, especially as Black women, have internalized the dangerous myth that our value lies in our capacity to endure, to keep pushing, keep smiling, keep achieving, while our souls are screaming for rest, for acknowledgement, for care. But what Mocha's work reveals is revolutionary. True strength isn't measured by how much pain we can hide. It's measured by how honestly we can face our struggles and transform them into purpose. Consider this illuminating example from a 2024 national survey examining Black parents' experiences seeking mental health care for their children. The findings were both heartbreaking and revealing. These families encountered obstacle after obstacle: difficulty finding culturally competent providers, prohibitive costs, creating financial barriers, stigma within both healthcare systems and their own communities, and a frustrating lack of information about available services. But here's where it gets interesting and where Mocha's philosophy comes alive. In the face of these systemic failures, these parents didn't surrender. They became advocates, researching resources independently, building peer support networks, and demanding culturally relevant care from providers. Their persistence led some families to secure appropriate treatment for their children. Others launched local awareness campaigns or joined advisory boards at clinics to improve services for everyone. The survey directly informed policy recommendations now being considered by several state legislatures regarding funding for school based counselors trained in cultural competence. As Mocha would say, this isn't just a story about barriers, it's a story about transformation, about how the very act of fighting for your mental health becomes a catalyst for broader social change. And that's the second crucial insight from my conversation with Mocha. Barriers exist, but community support and advocacy matter profoundly. The reality is that Black professionals, youth, and families encounter significant obstacles to accessing mental health care. Stigma, lack of culturally competent providers, systemic bias, structural racism. These aren't abstract concepts. They're daily realities that literally determine who gets help and who suffers in silence. A cross sectional study analyzed psychological distress among nearly 50,000 US born versus non US born Black adults across America. The findings were revealing. US born individuals experienced higher rates of moderate to severe psychological distress than their immigrant peers, with risk factors including unemployment, divorce or separation, lack of insurance coverage, and education level. The researchers recommended tailored interventions sensitive to nativity status, recognizing that assimilation stressors affect subgroups differently, and called for disaggregated data collection as a step toward more personalized care solutions. This research prompted some community organization serving African American populations to revise their outreach strategies based on these differences, offering targeted workshops addressing unique stressors faced by US born clients versus newcomers. What's powerful about this example is how it demonstrates that overcoming mental health challenges isn't just an individual journey. It requires both personal resilience and collective advocacy. It demands that we see the nuance in our experiences while recognizing the systems that shape them. As Mocha emphasized in our conversation, when we understand the specific strengths and challenges within our communities, we can tailor purposeful interventions that uplift whole groups. But perhaps the most transformative insight from our discussion was this: purpose emerges from healing. When we embrace our own healing, when we seek support when needed, we open doors not just for ourselves, but for others who may be struggling silently. Living with purpose after surviving in mental illness can inspire change within families, workplaces, and entire communities. Consider this stark example that Mocha shared with me. Research published in May 2025 revealed that despite similar clinical presentations during emergency visits related to self harm and suicide risk assessments, Black youth were disproportionately labeled high aggression risk compared with white peers, even when objective evaluation scores matched. This structural racism resulted in differential treatment, including increased surveillance and intervention intensity, which could deter future help seeking behaviors among affected youth and families. But here's where purpose emerged from pain. Advocacy groups leverage these findings as evidence supporting anti bias training requirements at pediatric emergency departments nationwide. Hospital administrators began reviewing flagging protocols aiming at reducing subjective labeling practices. Some institutions have since reported lower rates of inappropriate high aggression flags after implementing standardized assessment tools along with staff education modules centered on implicit bias awareness. Hospital systems piloting reforms have seen improved patient and family trust ratings alongside reductions in unnecessary escalations during behavioral emergencies involving young people from marginalized backgrounds. This research continues fueling reform efforts aimed at dismantling systemic barriers so all young people receive equitable crisis intervention rooted in compassion, not stereotypes. What strikes me about this example is how it highlights that overcoming institutional obstacles requires both inner fortitude and collective action toward lasting change. It shows us that when we heal ourselves, we can heal systems. As Mocha so eloquently put it, this isn't just about surviving your own mental health journey. It's about using that journey to create a world where others don't have to struggle in the same ways you did. That's the essence of transformative strength, not just enduring, but evolving, not just surviving, but creating, not just healing, but helping others heal too. So, where do we go from here? What does this mean for you listening right now? I challenge you today. Reach out intentionally to yourself or someone you know who may be struggling and start an honest conversation about what support looks like. Seek out culturally responsive resources if you need them, or share those resources if you already have them. Advocate fiercely where you see gaps in your workplace policies, in your community organizations, in your places of worship to ensure no one faces these battles alone. Because here's what I know with absolute certainty after my conversation with Mocha C. Brown: the world changes when we refuse to be silent about our struggles. Systems transform when we demand they see our full humanity. Communities heal when we make space for vulnerability alongside strength. Your mental health journey isn't just about you, it's about all of us. And when we embrace that truth, when we see our individual healing as connected to collective liberation, we unlock a power that can truly change the world. The journey won't be linear. There will be days when breathing feels like an act of revolution, days when getting out of bed requires more courage than climbing a mountain, days when you wonder if healing is even possible. But I promise you this: every time you choose to face your pain instead of burying it, every time you reach for support instead of suffering in silence, every time you share your story instead of hiding it, you're not just changing your life, you're changing the narrative for generations to come. This is not about perfection. This is about progress. This is about turning our wounds into wisdom and our struggles into strength. This is about creating a world where mental health isn't whispered about, but celebrated as an essential part of our humanity. So today I invite you to join Mocha's Revolution, a revolution of radical self care, community support, and systemic change. A revolution that transforms surviving into thriving, that turns trauma into purpose, that creates pathways to healing, not just for ourselves, but for everyone who comes after us. Because in the end, our freedom, our collective liberation begins with our healing. And that healing begins now with you, with me, with all of us together.